I'm Dr. Jonathan Berman. I'm a plastic surgeon and I practice in Boca Raton, Florida. I've been in practice for just about 30 years. We've had a lot of questions about different operations, and so I've made a bunch of little videos to help try to answer some of the common questions that we receive. The biggest discomfort people have following the tummy tuck is not from the incision itself, but for the muscle tightening sutures that we put in the midline to kind of make the convexity of the abdomen more flat and straight. So that's why we recommend that you don't take up or do any strenuous physical activity for probably about a month after surgery. Typically, I tell my patients that are tennis players, I don't feel comfortable with you getting on the tennis court for a month, and you're certainly not going to try doing your overhead serves for maybe 5 weeks, because it's going to be very hard to stand up and stretch and extend yourself until everything is in a better healing phase. What I mean by a better healing phase, it's going to take 4 to 6 months for everything to heal. But after 4 to 5 weeks of the surgery, you're going to feel well enough that you feel comfortable to try to endeavor to do more physical activity. Certainly, very few of us have the luxury that they can sit tight for a month after surgery. So probably after 2 weeks, as long as the big problem people have is to get around. So after 2 weeks, you're probably able to drive a car comfortably, get out of the driver's side, walk to the office, and perform your desk tasks easily. I'm not going to let you get on the Peloton. I'm not going to let you work out for a good 3 to 4 weeks after your surgery for the similar reason. You're healing, but I don't think it's safe to go on to do those things until 21 to 28 days after for the potential complications that can occur or the amount of discomfort and pain you may get for trying to push it a little bit too early. In terms of eating and bathing, you'll be able to eat regular food probably by the second or third post-operative day. We'll give you a stool softener to use for the first week so that when you bear down to have a bowel movement, it'll be much easier to do if you have a stool softener in it. And having a stool softener than without a stool softener. The pain medication also that we give unfortunately affects the GI tract, and it tends to slow things down. So we know that you're going to be uncomfortable. We know we're going to give you some pain medications. So we want to be very parsimonious with the pain medicines so that you don't get a lot of constipation, you don't get a lot of gas, you don't get nauseated, and you don't vomit from the effects of the pain medication. Certainly you'll be put on antibiotics for a good 5 to 7 days after the surgery.